FCOA Lesson 9 Advanced Equalization and Reverse Packing. For many divers, equalization is the limiting factor that determines how deep they can dive. Many freedivers wonder how they can evolve their equalization. When others explain how to equalize at depth, you might feel like a fish getting told how to climb in a tree. It's hard to understand what others talk about when you have not experienced it yourself. The best teacher in equalization is your own experience, and today we are going to meet our equalizing challenge in chest deep water. That's right, we can practice our deep equalization in chest deep water. We don't have to go down to 30, 40 or 50 meters. By exhaling before our chest deep dive, we can simulate a smallness in lung volume equal to 30 or 40 meters. We did practice some exhale dives in lesson 7. Today we will add an extra technique called reverse packing to squeeze some extra air out of our lungs before we gently lower ourselves to the bottom. Caution! Initially, practice this in chest deep water. You're doing something very extreme to your lungs. You're making them smaller than they've ever been before. Take it slowly. Feel your body. Keep your chin on your chest and your elbows near your ribs, and don't make sudden moves while you're in the squeeze. Mindset. You should be happy to be down there meeting the equalizing challenge. Not stressed, worried or frustrated, but happy. Like you've been given a puzzle and you're trying out the pieces. Like you've been given a computer game and you're slowly advancing through different levels. And there's no end to the game. There's always a next level. There's always a deeper depth to equalize to. But in this session, we will stay in chest deep water. We will exhale and reverse pack and lower ourselves. We will welcome our equalizing challenge at a depth where we feel safe, where we can stay for a while and figure out what exactly we are feeling inside our head, our throat, our ears and our lungs. If you would practice those things on a deep dive, then a big part of your breath hold time will get taken by you traveling. And down there you will be focused on the time and energy you need to get back up to the surface, so you would not be able to exclusively focus on equalization. During chest deep exhale dives you can focus entirely on equalization. Observe all the sensations that come with the challenge. The smallness of your lungs, the tension inside, and the fact that you can't move air from your lungs to your ears anymore. All those things you can observe for many seconds. And soon, once you get used to the exhale dives, these seconds add up to minutes. On subsequent exhale dives, you can start experimenting and playing with all the techniques that are out there. Pre-equalization, Valsalva, Frenzel, feet first, mouth fill, muscle isolation, sinus flood. Just try them all. Not two people experience equalization in the same way. So just try it and find out what works for you. As you evolve, you will discover that the equalizing challenge will always be there for you to play with. The only thing that changes is the depth where you encounter it. By the time you will do an actual deep dive, you will be prepared. You will already be familiar. You will be calmer and less stressed because all those sensations, you already know them. You know what they are and therefore they won't worry you. On some of those dives we will not wear our mask or our nose clip because you don't need them and you should not grow dependent on them. Dependence comes with anxiety. If your mask floods, that should not be a reason to discontinue your dive. You should simply accept that now you have blurred vision and you should be okay with that. As an option during your equalizing challenge, you could practice the flooding of your sinuses. Now this could theoretically cause allergic reactions or infections, so you can ask yourself if you want to risk it. Yet the benefit of getting used to seawater in your sinuses is that you will lose all fear related to leaking nose clips or leaking masks. Also, some athletes of the past used this method to gain some extra meters in depth. Spend many seconds and minutes experiencing your equalizing challenge before you start asking, why doesn't it work? It takes time. Let's try some reverse packing right now. Exhale completely. And now use your throat area to pump even more air out of your lungs. You can see my Adam's apple move as I pump out more. Now try to equalize. You might even meet your equalizing challenge right here above water. Once we do it in chest deep water, don't go down until you have reverse packed yourself empty. That's when you can't squeeze out a single bubble anymore. In that way, you make the best use of that 1 meter of water pressure to meet your equalizing challenge. If you're still able to equalize, then maybe you did not reverse pack to the max.
Again, I had a little bit of contractions. I'm not sure if you can see the little shocks that go to my body. So I try to take control of my diaphragm when it happens. And I was able to equalize my left ear. Had a hard time to put it into the right. Eventually it worked. Again, I sucked out a little more air out of my system, blew that tiny little bubble. And again, in the equalizing challenge, playing again. And probably my equivalent air depth is around 70 or 80 meters, because I blow out a lot of air before I go down.
The word reverse packing comes from the word packing, a technique athletes use to inflate their lungs to a bigger size in an attempt to be more compressible and able to dive deeper. It's considered to be an advanced and risky technique, since you're blowing up a balloon further and further and it could rupture if you overdo it. Reverse packing is the opposite. We are emptying our lungs completely and then squeezing out some more. Luckily the lungs are very squeezable, and when done gently, the risks are neglectable. If you like to calculate to what depth you can equalize, then you're basically looking for the full lung equivalent depth. Let's look at a diver with 4 liter lungs. If he exhales completely, he still has a residual volume of a quarter, so that is 1 liter. It would be the same size as he starts to dive with full lungs and dives down to 4 bar or 30 meter. If he now descends to 1 meter, 1.1 bar, then this new volume is 1 liter divided by 1.1 bar, which is 0.9 liter. His full lung equivalent depth is 4 liter divided by 0.9 liter, which equals 4.4 bar, and that is 34 meter. If he would first reverse pack his lungs to only 0.5 liter, like that there's only half a liter left in his lungs, then 4 liter divided by 0.5 is 8 bar, which is 70 meter. And if he descends to 1 meter depth, his 0.5 liter lungs divided by 1.1 bar of water pressure will reduce to the volume of 0.45 liter. His full lung equivalent depth would be 4 liter divided by 0.45, which equals 8.8 bar, which is 78 meter.